Two patients walk into two different clinics with the same diagnosis, peripheral neuropathy. One gets laser therapy and the burning in his feet fades over a few weeks and he starts to sleep through the night again. The other gets the exact same laser therapy from a provider running the exact same protocol. Nothing changes. The burning is still there in month 2. Same device, same settings, same diagnosis written on the intake form. Completely different outcomes. If you ask most people why, they'll say the treatment didn't work for the second patient. That's the wrong conclusion because it's built on the wrong question. And the wrong question is probably the single biggest reason neuropathy patients spend years and thousands of dollars without getting any better. Almost every patient who calls the clinic asks some version of the same question. Does laser work? Does electrical stimulation work? Do supplements actually do anything? Is chiropractic care legitimate for nerve pain? Here's the problem. That question can't be answered in isolation because it's missing the one variable that actually determines the answer. The real question isn't whether a tool works. Here's the real question. What problem is this tool built to solve, and does this specific patient actually have that problem? A modality isn't inherently good or bad. It's either matched or mismatched to what's actually driving that patient's nerve dysfunction. And that distinction changes everything about how you should evaluate treatment, both as a patient and as a clinician. Every tool used in neuropathy care was designed to primarily move one lever, even though most of them influence several systems at once. First, if you look at electrical stimulation, it's built to activate nerve signaling. It sends a controlled signal through a nerve pathway and encourages it to fire more normally. It may also support circulation along the way, but activation is its primary job. Infrared light and laser therapy are largely circulation tools. They're designed to improve blood flow to tissue that's been starved of oxygen and nutrients. That matters enormously for nerve health, but only if poor circulation is actually the limiting factor for that patient. Exercise, especially resistance training and aerobic training, primarily work on metabolic function. It improves insulin sensitivity, glucose regulation, and mitochondrial efficiency in the tissue surrounding the nerve. It also improves circulation, which is one reason it shows up in almost every treatment plan in some form. Nutrition and targeted supplementation help change the biochemical environment the nerve lives in day after day by influencing inflammatory load, micronutrient availability, and oxidative stress. Medications in some cases are primarily symptom control tools. They quiet signal without necessarily changing the underlying environment that produced it. And then balance and proprioceptive training, it doesn't treat the nerve directly at all, but it rebuilds the functional output that's already been lost by retraining the systems the brain uses to compensate. And then manual therapy and spinal work can address mechanical contributors such as nerve root irritation, compression, alignment issues that add stress to an already compromised system. Every one of these approaches, they're legitimate. Every one of them has a ton of research behind it. None of them does only one thing, but each only has one primary job. And the mistake happens when one of these tools becomes the entire treatment strategy instead of just a piece of it. And here's another pattern that I've noticed over the years. Clinics naturally become experts in the tools that they own. So if a clinic specializes in laser therapy, all the patients start looking like laser patients. If it specializes in shockwave therapy, more patients start looking like a shockwave patient. If regenerative medicine is the focus, stem cells and PRP naturally become more of the treatment plan. If medication is the primary tool available, medication often becomes the starting point. And if nutrition is the primary focus, supplements naturally move to the center of the conversation. Now, none of those approaches are automatically wrong. In fact, every one of them may have a role for the right person. The problem begins when the treatment is chosen before the biology is understood. Neuropathy doesn't care what equipment or supplements you have sitting in your treatment room. It only responds when the treatment matches the patient's biggest constraints. This is exactly why so many neuropathy patients arrive at a first visit with a folder full of receipts and almost no progress to show for any of it. Clinic A does laser. That's the whole model. Walk in, get the light treatment, walk out. Clinic B, they sell supplements. Every visit ends with another bottle. Clinic C only adjusts the spine because that's what the scope that they're set up to do. And then Clinic D only writes prescriptions because symptom control is often the fastest thing they can offer during a short visit. None of these clinics they're not doing anything necessarily wrong. They're doing the thing that they do well. Every one of them is looking at the patient through a single window into a house with 4 or 5 rooms. Nobody is walking through the entire house to find out where the fire actually is. So imagine calling the fire department because you see smoke coming from your house. The first crew rushes over, but they only check the kitchen. The second crew rushes over, they check the garage. The next crew, they check the attic. None of them are incompetent. They're simply looking through a very narrow window. Until someone searches the entire house, nobody really knows where that fire started. So we've met patients who've been through 4 clinics in 3 years before finally reaching us. They're not skeptical because they're inherently difficult people. They're skeptical because every previous provider sincerely believed their approach was the missing piece. And every time, that promise ran out somewhere around month 2 or month 3. So the patient tries laser, some improvement, and guess what? It plateaus or goes backwards. So they move to supplements. Maybe they get a little bit more progress, maybe they get none. Then they try a pain management doctor or a chiropractor. Some relief, but the burning at the night does not change. 18 months and 4 clinics later, they've been told that it doesn't work for everyone. When the real issue was never any single treatment. It was that nobody stopped to ask what was actually driving their specific case. So let's go back to the 2 patients from the beginning. Same laser, same protocol, completely different outcomes. Because their biggest constraints, they were never the same. So the first patient, reduced circulation happened to be the biggest constraint, holding recovery back. So the laser directly addressed that patient's problem. The blood flow improved, and then the nerve environment improved, and then function followed. For the second patient who had no results, circulation wasn't the biggest constraint. Maybe it was glucose variability, blood sugar swinging enough from day to day that the nerve signaling kept getting disrupted faster than any local treatment could repair it. Maybe it was autonomic problem affecting how the nervous system regulates circulation and temperature. Maybe it was severe balance and proprioceptive loss that no amount of localized circulation was ever designed to fix. Same tool, different biological environment, so different outcomes. Think about it this way. It's like watering a plant that's actually dying because it isn't getting enough sunlight. Water isn't a bad idea, it's simply solving the wrong problem. The plant doesn't need less water, it needs more light. And no amount of additional watering fixes what is actually wrong. Now, this isn't just true for laser. A patient with severe metabolic dysfunction who only receives electrical stimulation may see some improvement in nerve signaling, but they'll often hit a ceiling because the biochemical environment producing the nerve damage has not changed. A patient whose primary issue is mechanical nerve compression may experience real relief from spinal decompression that no amount of supplementation could ever reproduce. Now, here's why this matters beyond clinical details. I've seen this over and over. Patients in this situation often start to blame themselves. They think, maybe my neuropathy is just too severe. Maybe I'm past a point where anything can actually help. Maybe I'm just one of the people treatments don't work for. Sometimes that's not what's actually happening. Sometimes the treatments they tried was a perfectly good treatment. It was simply applied to the wrong biological problem. That's a very different situation from being beyond help. And that distinction matters because one of those stories leads to people that give up. The other leads them to ask better questions. So instead of asking, does this treatment work? You can ask this instead. What's the biggest constraint preventing this nerve from recovering today? That's a constraint question, not a treatment question. Once you can answer it, choosing the right tool stops being a guess or simply a matter of which clinic you happen to walk into and what they offer. In practice, that usually means looking across several categories at the same time. Metabolic health, circulation and tissue quality, the nerve's own signaling and structural integrity, and functional systems like balance and sensory processing. A patient's biggest constraint might sit primarily in one of those areas. And realistically, more often, we see that it's a combination of 2 or 3 of the areas. And when multiple constraints exist, the order you address them often influences how quickly the others begin to respond. Once you stop asking which treatment is best, you can finally ask a much more useful question. Which constraint should we solve first? Underneath all of this, what patients actually want was never a device. It was never a supplement bottle, and it was never a treatment plan. They simply just want their life back. Want to walk to the mailbox without watching every step. Want to stand at the stove long enough to finish cooking dinner. They want to sleep through the entire night without waking up because their feet are burning. Now that's the real goal. The modality, that was never the goal. It was always just a means to getting their life back to where it should be. They lost that life because nerve environment broke down. The combination of metabolic, circulation, signaling integrity, the areas that surround the nerve, they changed over time. And that environment is different for almost every patient, even when the diagnosis on paper is exactly the same. That's why so many well-intentioned, evidence-based treatments, they fall short. They're often correctly applied, they're simply aimed at the wrong constraint. The moment this begins to turn around, it's not dramatic, it's ordinary. It's standing at the stove quietly without your feet yelling at you. It's walking to the mailbox without mentally rehearsing every single step. It's sleeping through an entire night without waking up from the burning pain. Because fear doesn't announce itself when it leaves. One day, it's simply gone. The patient isn't managing a condition anymore. They're just living again. That's what the 360 neuropathy system is built to identify. Not which single modality is objectively the best, but which combination of tools actually matches the environment your nerves are sitting in right now, room by room, so to speak, constraint by constraint. Until we know exactly which one deserves attention first, sometimes that means using only one modality. More often, it means sequencing several of them in the right order. For one patient, that might include exercise, nutritional support, circulation-based therapies, and balance training. For another, it may involve spinal care, electrical stimulation, and metabolic intervention. For someone else, regenerative medicine may have a better role or bigger role. The point isn't which treatment wins. The point is that no treatment should automatically become the answer before you understand what the nerve actually needs. That's the difference between randomly stacking treatments and building a strategy around factors that actually limiting recovery. Of course, when you look at it, good treatments, they matter. Good providers who care about you, that matters as well. But neither one consistently succeeds without understanding the environment the nerve is trying to recover in. That's why I don't start by asking which treatment is best. I start by asking which constraint matters most, because the best tool applied to the wrong problem is still the wrong treatment. Before you spend thousands of dollars on any neuropathy treatment, you should understand this one thing. Every modality has strengths. Also, every modality has limitations. In the next video, we'll break down what today's most common neuropathy technologies can realistically do, what they can't do, and why understanding that difference changes how you evaluate every treatment that you're offered.